Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care so that you can have real power, real control, and so that you can influence decision making. In last week's questions, we looked at breathing tubes and how long they can stay in. In this week's episode of Your Questions Answered, we look at tracheostomy tubes, what purpose they serve in intensive care and how long they can stay in. So last week I touched on breathing tubes, their purpose and how long they can stay in. This week I want to talk about tracheostomy tubes. A tracheostomy tube is often used in intensive care for the purpose to wean a patient off the ventilator. It's usually the next step after somebody has been deemed a difficult or slow wean off the ventilator. Generally, if your loved one is expected to be on the ventilator for more than 7 days, a tracheostomy insertion would be necessary. This time frame might vary from unit to unit to plus minus a few days here and there. A tracheostomy can be performed percutaneously, which is a needle puncture of the skin, or it can be performed surgically in the operating theatre. Both techniques are widely used in current surgical practice, and the difference from an ICU perspective is usually that the percutaneous tracheostomy insertion is performed in intensive care by the ICU doctors and the surgical tracheostomy is performed in the operating theatre by a surgeon. Also, a surgical tracheostomy is often performed if the tracheostomy is meant to stay lifelong. Once a tracheostomy has been performed, usually the sedation for breathing tube tolerance can be taken away and your loved one is able to be woken up. Once a tracheostomy is in place, ventilation can be tolerated so much easier, as generally no sedation is necessary any longer. Your loved one will be able to have their teeth brushed properly and generally have good mouth care. Also, tracheostomy ventilation is so much easier to be tolerated, as the tracheostomy generally doesn't cause any pain or discomfort. As you might have already seen, your loved one can also have a good cough, and suctioning sputum tends to be a lot easier as well. Now let's look at the most important part of the tracheostomy in intensive care. Generally speaking, if your loved one is ventilated in intensive care and has a tracheostomy, your loved one can be taken off the ventilator as soon as he or she is more awake, and your loved one should then be in a position to be gradually weaned off the ventilator. It still might take a while, and whilst the start of the weaning process can be slow, with maybe 2 hours off the ventilator per day initially, and then increasing the time off the ventilator from there, it's a good starting point. There still can be setbacks during the weaning process, and you and your critically ill loved one might have to be patient. It's hard to put a time frame on how long it takes to A. being weaned off the ventilator, and B. have the tracheostomy tube removed. It often depends on what other things your critically ill loved one has going on. Sometimes patients do go back to a ward with a tracheostomy tube still in place and without a ventilator, and sometimes both the ventilator and the tracheostomy will be removed before your loved one can go to the ward. Sometimes the ventilation and the tracheostomy might be prolonged, and sometimes your loved one might end up staying in intensive care for a prolonged period of time. Setbacks such as infections or an extensive pre-medical history can make the weaning process more difficult. Other factors might come into play as well, such as the lack of quality of life and depression in intensive care. So I hope this episode shed more light on tracheostomies and ventilation in intensive care. If you have any questions, just send them to me to support@intensivecarehotline.com and I'll answer them personally. Thank you very much for watching another episode this week of Your Questions Asked at intensivecarehotline.com, and if you haven't subscribed to our free membership, sign up now and you'll get your free instant impact report, where you learn how to take control and charge of your and your critically ill loved one's situation without being reliant on the doctors and the nurses. You'll know exactly what questions to ask once you get this report, and you'll also discover how you need to manage yourself and others so that you can have real power and that you can have influence, so that you can influence decision making. You'll also get 4 other free reports: the 6 questions you need to ask the most senior doctor in intensive care, 10 things you didn't know doctors and nurses are talk about while you're not at the bedside with your loved one, 7 answers to the 7 most frequently asked questions if your loved one is critically ill in intensive care, and 9 myths of being a critically ill patient in intensive care. Thank you for watching this week. This is Patrick Hutzel from IntensiveCareHotline.com.